One.
All righty. So here we go again. This is episode 6 of Autonomic Dudes, and I am Rob Wilson, Dr. Rob Wilson, and we are minus Kyle Shannon, nurse practitioner. He is
We're
on
down
vacation.
one today,
You're down one.
unfortunately.
So just Nick Zapata and I are glorious, fantastic summer intern. So it's just us, Nick.
Yeah, just us for today. It's a little
Yes.
back and forth
Yes. So
conversation.
we're going to do without Kyle, but he did agree to let us do this without him, right?
Yeah, so at least we're not going behind his back doing this.
No, exactly. He
Yeah.
agreed. He agreed. So
He'd be
Kyle deserves
mad.
a vacation. He's a working machine. So
Hmm.
he deserves a day off.
Hmm.
So a week off. So we're going to discuss today. What's the topic today, Nick?
We're gonna be talking about the gut's connection to POTS, like your GI and just your gut microbiome.
Yes, exactly. And so that's a big idea that the gut and POTS. I was going to get started. I know you've done a lot of research on this.
Hmm.
I would say after the impairment of the circulation, the gut is probably the next biggest organ system that gets impacted in POTS. Remember, your gut is from your mouth with the tongue and the oral mucosa, your esophagus, that throat. A lot of POTS patients get that tight throat, difficulty swallowing, dry mouth, esophagus.
Hmm.
Next, your mouth to your stomach, you can't rest and digest in high sympathetic states, your stomach, your intestines, and all the way out, and your salivary glands. So there's a lot of area. It's a big neuromuscular nerve immune highway.
Yeah, definitely. I wanted to talk about that rest and digest. I wrote that down a couple of times on my notes for this episode because I was taking notes. I was doing some research and it just clicked with me that your gut really does the rest and digest. That was something that they taught us over and over again in school was rest and digest for the parasympathetic nervous system, which is the part of your nervous system that inhibits stuff, that kind of calms everything down. But when you have POTS and when you're in that excited adrenergic state, when you have all this adrenaline, you're not activating your parasympathetic nervous system, so you can't rest and digest, and your gut, you can't digest. Your gut can't do its job properly.
I mean, you're spot on. I mean, and that basic rule that we're all taught, and it's emphasized in medical school and nursing school, needs to be anchored over and over again. I repeat that over and over again so many times, and I think people forget that at so many levels, from medical providers to patients, and it's easy to, right? When you don't feel well and you're so many things get distracted, but your body is trying to be in this balance or doing different purposes. But if one direction you have this high sympathetic tone, adrenaline to keep the circulation going, it's going to impede that rest and digest. So you can't digest, and it's meant to be, you shouldn't be eating a hamburger if your body's in survival mode or high sympathetic. You should be light and empty and not digesting. So people really are going to have impaired digestion at some level. And we find for the majority of our patients, if we can get that balance or that sympathetic tone back in order, that a lot of their digestion gets better. So we see a lot of our patients will say, like, my digestion's off and I can't eat and I'm bloated and I have irritable bowel, I'm diarrhea, I'm constipation, or I'm constipation, I have leaky stools and my throat's tight. I'm strangled feeling my throat, my mouth's dry. We reduce that sympathetic tone, they do better. But you're right. That comment you made is spot on, my friend.
Yeah, and I wanted to go on to that. And this is a thought that I had while I was taking the notes that I wasn't 100% sure about, but that kind of made sense. I guess it's like when you have normal gut function, you're expending energy to get energy out of the food that you're digesting. But when you're in that adrenaline state, when you're in that sympathetic overdrive, you're just so much adrenaline is getting pumped out, and that's spending so much energy just keeping you tense and alert, and you're not getting any of that energy back. What is that why you like a lot of people feel fatigued and tired when
Well, I
state?
mean, Nick, you've been doing your reading. I've been
I
seeing you
mean,
take notes, and I think it's like, oh my gosh, is he planning something about me? I've been teasing you, but you're right. So think about this. When you eat, about 2 units of blood go to your gut. So a lot of people, when they have when we all eat, we get tired, especially carbs, carbohydrate foods. big pasta meals, big carb meals pull blood to your system. I always call it the Thanksgiving meal effect. So if your body's in sort of this crisis mode, so typical fight or flight, like picture of your body, you're like the animal, the human, the ancient wilderness, like in a lion's getting you or a bear's trying to get you. You shouldn't be eating, and you're meant to get the blood to your muscles and survive. Having food in your gut is not meant to be a good idea. So you shouldn't be digesting, you shouldn't be eating. So it's really not the idea to have all that energy being shuffled there. And all your energy should be going to, for your calories and nutrients, to really go to survival mode, muscles, energy expenditure, more sympathetic mode at level. And you can see things true when people have fainting. A more dramatic moment is there's this thing called the vagal response, which just seems confusing. You're high sympathetic, and if you faint sometimes, you'll get this vagal response. People actually will vomit and defecate. So you're totally disgusting in nature. So no animal will even get you. Like so when you really pass out, you might be totally wretched. So nothing will actually get you. You're just vomiting all over you and defecate. But you're right. There's an energy expenditure. You shouldn't have blood going to the area, and your body's meant to do process. Because even this condition, your body's trying to get the circulation. Your body has a confused message that you're sort of in this crisis and not should be eating. So your digestion's off.
Yeah, and we talked about this kind of last week, and you mentioned it just now, like with all that blood flow going to your gut and to your stomach, when you're having those large Thanksgiving type meals. And we talked about this last week, but while I was doing my research, I found like four major things to think about when like forming the right meal plan. Cause like it's obviously it's still important to eat while you have this condition. You can't just not eat, even
Oh, yeah.
yeah.
Well,
And
it is. It's like a muscle, right? We talk about it, training a muscle.
yeah. And what I found like the four most important things that at least I found were we talked about this last week again, but increasing fluids and salts, 2 to 3 liters and like 3,000 to 5,000 milligrams of salt. And also like having smaller, more frequent meals instead of like those larger Thanksgiving meals so that you don't have to spend as much blood going down into your gut and losing energy on that. I also found that eating like gut friendly foods were really nice. And I'm not really entirely sure on the definitions of like probiotic and prebiotic, but from the sites that I looked at, like probiotic foods such as yogurt and prebiotic foods
Yeah.
such as bananas, garlic, and onion are very useful and very healthy for the gut. And also just finding habits that work best for you. Like something that I found that was actually like really good advice. I was like, damn, this is like if I had pots, I would do this. Like keeping a food diary of like the foods that do work and the foods that don't work, the foods that make me feel better, foods that make me feel worse.
So I like what you're talking about is that your gut is, I always say, is picture a big nerve, muscle, immune highway cutting through your body from your mouth to your anus rectum, cutting through your body. It's actually the biggest nerve track in your body, neurons after your brain, your spinal cord number three. So it's a muscle, just like you train another muscle. A lot of these patients with their impaired digestion, they wake up, they feel queasy, they don't want to eat, they stop eating. You got to train that muscle. So they feel nauseous and queasy. So small meals do help people because once you stop eating, you don't want to eat. So small meals, find the foods that make sense. We'll get into the immune mechanisms. So really trying to find foods that feel right. Sometimes people will default to the carbs and they pull the blood and it might feel good initially because you feel like, oh, I felt there's food in my stomach. You feel right for a moment. And an hour later, you get that bankrupt, depleted, exhaustion feeling. You might even get your sugar that drops again, but really finding proteins to hold on to there. And it's challenging because these patients are like wrestling between diarrhea and constipation. They pull away from certain foods, and it can be tricky. There can be more episodes in this to find that balance. That and your immune system's in your gut. So a lot of these patients, because so much of your immune system's in your gut, like a large percentage, like 70, 80% of your immune system's in your gut, when it's very sort of stressed gut in this very sympathetic state, more allergies, more food intolerances. So often we get the adrenaline down by all that sympathetic treatments to dissipate between medications and wellness. They do better, but small meals, finding foods that work better, training your gut, getting proteins, getting the right fats help. Probiotics can help, but small doses, getting your body used to it. Prebiotics can be challenging because some people are allergic. It can be a
Oh yeah.
bowel irritant. But you're right, trial and error.
Yeah. And we were gonna touch, I was really listening to the podcast last week and I realized that we never really
Oh,
addressed fiber. Like fiber, I have also been reading is a very important thing because it promotes digestion, even maybe in those states where you aren't really open to digestion as well, not not so much open, but so much like can't digest as well. Fiber can help like speed things along.
yeah, well, you're right, and it's tricky, right? Because these patients don't feel well, and
Mhm.
they don't feel well, and they have irritable bowel, and sometimes fiber can work to help irritable bowel because it slows things down, it stops that motility to
Mm.
be so aggressive, and then patients that with some of the fiber foods make it worse, and it's got to figure out if it works for you and customize it for
Yeah.
yourself. And sometimes it can work both ways. You got to really work with each patient, say, how does that work, right? And those foods. That's why I think it really is key to get the adrenaline down, that sympathetic tone, that food diary, that journaling. Sometimes with diarrhea, it can work where fiber can help because what happens is if your bowel's a muscle and it has a certain beating and it goes a certain velocity, it will propel like a vicious cycle, spasm propel food forward like a wave. The fiber actually will wave things down in your bowel a little and reduce the amount of liquidy stool or runny stool. So the fiber can actually help people with diarrhea and even constipation. It can actually help form stools and with hydration, maybe reduce some of the constipation because it's bulking it up and give you that level. And then I think the key is looking for foods that maybe you can use besides supplements of fiber to say this makes sense. One person was eating sweet potatoes because it actually was nutrients, it didn't give allergies, and it made sense. But because fiber seems counterintuitive to someone with diarrhea or someone's constipation. It's like, why am I adding this? I'm gonna have more diarrhea or I'm gonna be more constipated. But slow and steady trial, it can make sense to help people because their bowels are dysregulated. The word's dysregulated for these patients. Good point, my friend.
Yeah, definitely. I think the diary, like when I read about the diary, I was like, I think that's a great idea. But I wanted to add on to what you were saying earlier when you referred to the gut as kind of like a highway point between, like you said, it was like the second largest nerve center of besides the brain, right?
Yes. Oh, definitely.
Yeah.
Second biggest area. It is. It's a big immune thing. And the thing about this, I know you're going to love this 'cause I know you're into the brain and
Yeah.
experiences. The vagal nerve, which means vagal means wander, communicates from your brain down. So it's this communication, and the gut can actually work independent of the rest of the nervous system. And you
Wow.
think about this, like butterflies in your stomach when you get nervous, or how a lot of times your bowel reacts, or we all know this. We get hungry at certain times of the day. We have to go to the bathroom at certain times of the day. It all makes sense.
Yeah, it
And
kind of feels out of our control.
yes, right.
Yeah.
You eat, you have to go to the bathroom. There's a gastric colic reflex. You eat, you got to go to the bathroom. So it all makes sense. And so um, it has a rhythm, it has this brain, it has a memory, it has a thinking, and can hold on to things. And your gut can hold on to emotions. We all know this as people, right?
Yeah. But in addition to that, I wanted to talk a little bit of like the gut bacterial microbiome because I like,
Ooh,
that's a mouthful, but it's just basically like your gut has so much bacteria and so much beneficial bacteria because I think that's a very big misconception is that it's all bacteria is bad, but there's a lot of good bacteria in your body and that bacteria helps with digestion and helps with getting the all the energy out and getting that energy and all the nutrients out into your body. But when you have POTS or some other autonomic conditions, that the bacterial balance can be it the bacteria can be thrown into an imbalance. And what I was reading, I don't know exactly why, but what I was reading is that that can cause inflammation and impaired autonomic communication between the gut and the brain. So it can mess up that highway system that you have and that impaired autonomic communication can lead to like increased or worsened orthostatic symptoms like like blood pressure, like that type of stuff. It
I
can.
think that's absolutely essential what you just talked about. And it's that these patients, um, your bacteria is a garden in your gut,
Mhm.
a beautiful, rich garden of normal bacteria, and it's doing things. We're learning how it ties into memory, wellness, mental health,
How to nurture it.
metabolism, weight gain, all these things that we're learning about that's doing. And all this incredible things, and that we look at COVID patients, for example, who get long COVID, their gut gets violated with this and more. And so the high sympathetic state where you can't rest and digest, we're learning, and it's a good theory that it might shock this bacteria. And you're right, it gets moved or translocated. And you're right, we see people who get really bad infections of their bowels, and that good bacteria goes away or gets moved or altered. These people get really messed up. It may not be related to the POTS patients, but people get these hospitalized infections of their bowel or these bloodborne infections. They get antibiotics, and their normal bacteria of their gut's gone. They get really, really sick, and they're incapacitated medically, brain function. They're that way. So good bacteria in your gut has a lot of benefits, and the research is growing, growing more. The tricky thing for a lot of patients is to um, learn how to get the good bacteria back. A lot of people can't do yogurt, natural yogurt. They can do soy yogurt. They can do probiotics, but to find that sort of sweet spot that works for them.
Definitely. Speaking about the inflammation though, I wanted to ask you, how does mast cell activation syndrome relate to like the gut and POTS?
Yeah. Oh, mast cells
Heard about that a
interesting.
lot. Yeah.
Yeah, I mean, it is. Most of your immune system's your gut. The mast cells are your allergic system in the basic sense, and they're the first responders. They're like your paramedics. And think about this: you're eating, bring food into your system. It's basically you're bringing the world into your mouth, into your gut, and all that stuff you're eating. So who knows all the food we eat? It goes into your
Yeah.
gut. Your immune system's in your gut. It's the first place that's going to flush and clean it all out.
Hmm.
And so these mast cells are lining your intestines. So a lot of the mast cells line the gut, the bladder, the gynecologic area, your mouth, your nose. So the sympathetic system does ramp up the mast cell. So these patients who are high adrenal, high sympathetic, their guts are highly altered. The mast cell gets active in the gut. So you'll see these patients who are very GI suddenly say, I have more food intolerances, I have more food allergies, I eat, I get rashes, I get
Wow.
acne. It's all ties together. And it's like, do I really, I have POTS, I have mast cell, or I have mast cell POTS? It's probably all just the same animal. It's
Yeah.
like it all belongs together. It all belongs together.
Yeah, because
And
then you start thinking about like the inflammation, and it actually makes a lot more sense now. Like when your gut is thrown off balance, those mast cells start going like, oh no, something's wrong. So they start
yes,
inflaming, and they cause that uncomfortableness, that uncomfortable feeling, your inability to digest because things just get stuck in there and unable to like process. And
yes, yes,
yeah,
yes.
that
And a
actually
lot of
makes a lot
times,
of sense now.
exactly. So a lot of times calming down that adrenaline helps, getting the gut to eat well,
Mhm.
probiotics. I mean, and some people need different levels of treatments. They'll use antihistamines, Pepsid as an antihistamine. They'll use a lot of wellness things that really get that, and they just get your body in a very calm state. Benefits of yoga, people use acupuncture, Tai Chi, good rest, wellness gets the body in a very calm state, helps them
Yeah,
beautifully, just gets things just in that zone, just sort of helps them greatly. Will just
yeah,
get
like
them better.
those medicines for those specific symptoms. It's really interesting.
Yes. Oh, exactly.
Yeah.
Exactly.
Like I
And
was looking, and I was hoping you could tell us a little bit more about these medicines that I'm about to list off. But for like nausea, I was saying like antiemetics would work for this thing called immune mediated GI dysmotility. Supposedly corticosteroids and intravenous immunoglobulin helps too. And like for
well,
pain.
yeah, I mean, it's um most of these patients um we don't use steroids much. The data's not super there. There's some
Yeah.
people read about on social media and steroids to adrenaline patients, like throwing kerosene on a fire, and it's short-lived. It's not always the best thing to always use for people, um, um, all the time.
No, of
Um,
course. I was just trying to run
no,
it
no,
by.
you're good. You're bringing up important things that you're reading about. You're bringing important things. IVIG is still very customized for certain patients. I would say really from our data, about 2% of patients are eligible based upon blood testing. We really want to see very clear data when we have neuropathy and gastroparesis and other organ system injury. There's been some clinical trials recently that showed negative results that didn't show promise for POTS patients. I know patients were looking forward to that positivity, but it's a very much of a customized care package for it.
No, that I think it's important that we're talking about this because I got this information from like a quick Google search or just asking like Chat GPT and AI, and that these are the first things that come up. So I think it's important that we do this because if any other patient is going to look up their symptoms and they're going to immediately see, oh, I should take corticosteroids, and then they just get on them and it gets substantially worse for them. I think it's good that there's at least something out there to
Yeah, well,
educate.
you're right. You're right. With AI and social engines, what's filling it now is what people are looking for.
Mm,
And people are looking for answers. Patients want better treatments. That's why we do research.
yeah.
People are desperate because they want to feel better. And I respect the patients. And IVIGG has been looked toward for a decade, and we're still looking to it. But it's a hard medicine. It has side effects. It's not an easy medicine, and it has to be for the right patient. And there's certain criteria for it. We will find a positive autoimmune blood testing, and the patients that who do get it have very significant organ systems. I mean, like gut, cardiovascular, glandular system abnormalities. So it's usually a package. So a patient with POTS who just has POTS, I hate the word just, only alone without other things should not get IgG because the medicine is not easy. And what's the end point? 6 months, 1 year, and what you're going to maintain for it. So you're what you're doing is bringing up a lot of information. And again, AI is pooling what people are doing. So it's only as good as what's being fed into it.
Yeah. I think that what a person can do by themselves is more important. I mean, maybe important's not the right word, but like you it's not the best thing to just ask Dr. Google and expect all the answers. I think the best thing that a single person can do, like an individual can do, is take care of themselves and like with the diet and with that food journal, it's just do those type of things. And
And I think working with your medical team is a really paramount thing to do. And to do that, so it's like it's a village, right? Like you're saying, like it's you have the diagnosis, which gives you diagnosis, realizing how it's impacting your body, getting educated, like we're doing on this podcast, and then looking at every aspect that, hey, this is another factor that could be contributory. You're right, my friend. You're absolutely right. This is another factor that could be tying into this. This is another layer that could be something to this. I respect what you're saying. That's brilliant.
I also did want to ask something that's just coming up on my mind right now because I'm remembering what I was reading. But sometimes, like, I remember reading that sometimes, like, those GI symptoms and those, it can be completely independent of POTS. And maybe they arise because of each other, or maybe they have no correlation. So I was wondering, like, how is a medical provider able to differentiate whether it's because of POTS, whether your GI issues are because of POTS or your POTS is because of your GI issues, or whether they're just two independent things going on at the same
So
time.
I think is you make sure first is we always want patients to be checked for nutritional things. A lot of patients get vitamin depleted because they're not feeling well, they're not eating, and they're not absorbing nutrients. We will find a lot of times if we can do work just reduce the adrenaline, but to medications and all the POTS care, the GI improves. Sometimes patients do need to be referred to GI to make sure there's nothing else going on. Common sense things. We get patients who get peptic ulcer disease. We have patients who have severe reflux. We've had patients who've had polyps. We want to make sure patients are looked at medically. Nothing else is going on. Some of our patients have Ehlers-Danlos,
Mm,
which are hypermobile, and those patients have their own universe of
yeah, I've heard a
structural
lot about
issues
that.
motility issues. And then with that also, depending on the history, depending on what we hear, we might guide to certain testing looking for gastric motility issues, gastric emptying studies. And if those testing are negative, sometimes we work with certain GI people because we can't order certain testing. It's special, gastroenterology specific um, 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 dependent that they might order what we call the smart pill, the capsule endoscopy, the Israeli smart pill. We small, like a GPS smart pill you swallow, and it goes through your gut and time travels, and measures pH, and it actually will see how fast or slow your motility is. So it's
Oh,
really a
wow,
composite. Yeah.
it's impressive. I didn't know that
It
existed.
is, yeah. It's a pill that's neat because, but we can't order it. Patients think we can order it. It's owned by the GI department, and it comes in a box. You swallow it, and it's a big deal because some patients' guts are so sluggish it gets stuck. So it has to be stratified.
Oh yeah, damn,
Yeah.
that's crazy. Technology is wild these days.
Well, it is, and
I'm
with
always impressed.
technology, your point's well taken. With technology, you have to realize what can work and what can't work.
Hmm. I also wanted to ask, like, what are common symptoms that can let a patient know they're experiencing like abnormal GI function? I was looking up online and there was like a feeling of fullness, like maybe you'd like no appetite, that type of stuff, and like severe abdominal pain, that type
So,
of.
so your question of what kind of symptoms they go through.
Hmm.
So it's a whole, it's all these patients, I think, they go through a challenge, right? They have problems with dry mouth. And then people think they have Sjogren's. Some patients have Sjogren's with POTS, but adrenaline causes dry mouth. It can affect their teeth in that level. Also, that adrenaline makes that strangle feelings. They feel like they can't swallow pills. They can't talk. Like I can't talk right now.
It's running out of breath.
I know. What is with me? I can't talk.
Oh my God.
Strangle neck feeling. They get a lot of reflux, acid reflux, feeling things are stuck in their throat and their esophagus, bloated. They can't digest food. They feel full right away. And
Hmm.
then all the intestine feelings, they feel like there's like a soccer ball in their stomachs, and they have diarrhea, bloating, constipated pain, unexplained abdominal pain, diarrhea. They eat, and then 10, 15 minutes later, they got to defecate you know, all those symptoms, allergies of foods. I mean, I think that's a good sort of wraparound. And I think it'd be tricky. So you can imagine what these poor people go through. They go to a medical provider and they say, I feel this, and I feel that, and I feel that, and they're lost.
No, for sure. And it's got to be like a whole journey for them because I've seen people come from like out of state through many different providers and they come
Yes.
to here for a final talk and they finally meet someone that cares about them.
Yeah, so I think it's great. I think you go through the diagnostics, and I think I know we have a few minutes left on this, but I think is it's a wraparound, controlling adrenaline symptoms. A lot of times people need a wraparound. We saw acupuncture, biofeedback, people use to learn how to control rhythms of the body.
Mhm.
Sometimes your gut works independently. It's fascinating. People will use, there's work with hypnotherapy, hypnosis, because your
That
gut,
actually work?
yeah, it actually works.
Oh,
And um, because your gut can start doing, think about this. You're with me, Nick. You're a young guy. I almost be your dad. You eat a lot. You're hungry all the time. Your gut starts doing things on its own. You go to bath at a certain time. It's going a certain time. You get a
yeah, kind of
stomach
get the
hunger.
schedule.
A schedule. It starts working independently,
Yeah,
and you'll see things in people too, where who've been through life events and emotions and sadness. I mean, like even I mean, I'll be honest, my dog died a month ago. I had horrible stomach pain for a week. It was grief.
I'm
Our
sorry.
gut has all these things. 80% of your serotonin's in your gut. Mood and
That's
mood
crazy.
and emotions. So it's a wraparound. There's no magic pill. It's so complicated that sometimes we do counseling, biofeedback, relaxation techniques. If people think there's one answer for the gut, coming to this podcast, they're on the wrong podcast. And
Yeah.
some of our patients who have really significant GI issues are working with swallowing therapy, with speech therapy. they're working with gut doctors, they're working with us, they're working with counselors, they're working with actually a yoga person at times or biofeedback people, they're working with psychotherapists, they're working with some work with hypnotherapists. It's a team. The gut's a team party. If they think there's one supplement they're going to find online and it's going to be it or on social media, this is the wrong podcast for them. I'm sorry.
No, yeah. I'm always amazed by how complex the nervous system is. Like the more I learn about it, the more I learn that I know less. You know what I'm saying?
Well,
It's
dude, I gotta tell you this. We're gonna wrap up with this because we're running out of time. So think
uh,
about this. I eat carrots for lunch a lot of times, right? So yesterday I was chopping carrot for lunch. I think I eat a carrot, I digest, it goes in my stomach, all that acid breaks it down. I chew it up, it goes down my stomach. One of the carrots stayed in our sink, went down the garbage disposal. I activated the garbage disposal and it went, "Arr!" I said, oh no, I'm in trouble. Not even that garbage disposal can break it up, but my
oh,
mouth can
oh,
chew it up, my esophagus
yeah,
muscle can
yeah.
break it down, and my stomach acids can break it down. The gut is a powerful machine, but
We're
my
crazy.
garbage disposal can't break it down.
Yeah,
The gut is powerful. Be humbled by the gut. It can do a lot. And if your gut's not working, if you think there's one magic answer on social media that's going to fix it all, or some medical predatory person is going to get it for you.
Dr. Google.
Yeah, Doctor Internet,
Yeah.
anywhere. We're not going to Doctor Google or Doctor Bing
Oh,
or Doctor
yeah, no.
Instagram. We're
No
not going to bring
specifics.
them all out now.
Yeah,
Or
yeah,
Dr. Yahoo or Yahoo Nurse Practitioner or psychologist,
yeah. Right.
Bling Bing Bang Boom or TikTok. This, go for it. It's a complex thing. If you think it's millions of years of science and technology in the gut, nerves, muscles, immune. It's not one
Pretty
fix.
much. Yeah.
All right, Nick. I
Crazy.
talk too much. And
No,
and
it's fine. It's fine.
any last
I'm
minute
talking.
things you want to say to the page? You always give the inspiring moment.
Um, I mean, I guess just believe in yourself and find the right diet because that was the biggest takeaway that I found when I was doing my research is find the right diet for you because I think that's like the most impactful thing that you can do yourself that's in your control because you have all these medicines that you're seeing online that like you may or may not be able to get that may or may not work for you. But the one thing that is in your control is finding the diet that works for you and you can just it's take a journal, try to write foods and if it's
Yeah.
hard, but just believe in yourself.
And I agree. Beautiful. Empower yourself. We call it stakeholders. You
Mhm.
have a say, you have a voice. We believe in you. If you
Do what
say
you can
this,
do.
if this food doesn't work for you, it probably is something to it. Let's find what helps you. Um, we are humbled by the power and all and how the body can work and not work. That's why we do this work clinically, and that's why we do research. That's why we're doing this podcast.
Yeah,
So when you say
definitely.
things seem odd in your body, we get it. We are humbled and in awe of the body. All right, Nick.
Every
So
single day.
Kyle, wherever you're out there, you're on vacation.
He's
Vacation is
at
all
another
you
beach right
wanted.
now. He
Uh,
couldn't join us for this one.
yeah, yes, Kyle, we love you. We miss you. You're a good guy in this universe.
Hmm.
Um, you're an awesome guy. We miss
Miss you,
your
man.
kinetic energy.
Miss you,
All
man.
right.
All
All
right.
right. Power out.
Thank you for listening. Have
All
a good
right. Bye bye. Thank you. Good
bye.
job.
Thank you, you too.
Believe